welcome everyone. Great to see you here again. Yeah, many thanks for making the time to come along. Hopefully you'll find the session interesting. So this is the sensitive data use case report, playback and feedback session. So I'll be together with colleagues from the PSC, we'll be taking you some of the initial findings from the report and also discuss a bit the structure and content of the report. And we're really keen to get your feedback and thoughts on some of the outputs that we're going to get from the report. So in terms of today, so the purpose of today is really to share with you some of the findings, as I mentioned, from the use case identification workshop and invite your feedback. So we'll present a selection of slides that are contained within the report, basically to show the aggregated workshop analysis. So the PSC have done a tremendous job in bringing together all of those pieces of paper that you worked on and carrying out a sort of aggregated analysis of that, as well as doing some analysis on the deeper dives. If you remember, during the workshop, there was a sort of prioritization exercise where you could vote on some of your favorite use cases, and they were developed by you a bit deeper. So colleagues from the PSC will also cover a couple of examples of those to give you a sort of flavor of those use cases and crucially how they're going to be presented in the report. So in terms of the running order for today, so myself and colleagues from the PSC will present some of the key findings and the next steps for the Dare UK programme. That'll take around half of the time, and then we've got plenty of time essentially for the feedback discussion on the report. So we've got 30 minutes for that, up to 30 minutes for that, should we need it. In terms of housekeeping, if you have questions or thoughts during the presentation, please write them down as they occur to you, so you don't have to save them to the end. Just record them in the Q&A box, and we'll either answer it as we go along, or we'll come back to it during the feedback discussion. Like I said, we've got lots of time for that discussion, so do just write things down in the Q&A box. Hopefully you'll see that Q&A icon in the Teams webinar at the top. Okay, so just in terms of the purpose of the report, so really we want the report to reflect obviously the workshop and the workshop activities, but we really hope the report will help evidence the demand for bringing together sensitive data at scale for public good from researchers such as yourselves. But above all, I think what we hope the report will demonstrate this value to a wider audience. And that's especially the public. So I guess we need to be able, as people working with sensitive data or sensitive data infrastructure, to make the case not just as individuals, but also collectively for the public benefit that can be gained if we want to be able to gain the support from the public and funders to build this kind of research infrastructure. And the report will also help inform phase 2 of the programme. So the Dare UK programme is at a bit of an inflection point, as we talked about at the workshop a month ago. So we're coming to the end of phase 1, the design and dialogue phase, at the end of March. And from April, we'll be looking to transition into phase 2, in which we really want to include real world research exemplars. And I'll talk about that a little bit more at the end. And also to say here, we've actually had the opportunity to play back some of the findings, so some of the findings that we're going to talk to you about today, to a roundtable of senior leaders across different UKRI research councils involved in sensitive data research, and they received the findings with great interest, and we're really going to look to continue to work with them in a cross-council way in phase 2 to find out how we can best work together across different research councils to support interdisciplinary research. As we surfaced in the workshop, our societal challenges are cross-cutting and interdisciplinary, and we need to be able to carry out research that's able to address that in an interdisciplinary way. In terms of the audience, so this report is primarily aimed at engaging the informed public. So as I mentioned, we really want to demonstrate the opportunities and importance of linking data together. And so as we discussed in the workshop, we're really focused here on the opportunities, the public benefit that could be gained from doing this, whilst also being very cognizant of the challenges, which is obviously something that the phase 2 of the Dare UK programme will also be looking at. In terms of the publication, so we want to use some of the feedback that we collect today and to incorporate into the pre-publishing report, and we'll be publishing the final report in April. So of course we'll let you know as soon as that report is published. So now I'm going to hand over to colleagues from the PSC who've done a terrific job in turning all of that information that was gathered during the workshop into a meaningful story. So I'll hand over to a colleague from the PSC to take us through that.
Thanks, Valent. Yeah, so I'm going to talk a little bit about the methodology behind some of the different findings that we'll be presenting both today and in this report when it goes out. So if you cast your minds back to the workshop, we asked you to sort of collate lots of different findings onto various sheets of paper. We've taken all of those and analysed the outputs to sort of come up with the different findings we'll be presenting. So there are 3 main activities that we did. So firstly, you collectively came up with 52 different use cases, and we sort of analysed those to understand the types of data that you suggested would be used, the problems they were addressing, and the kinds of outcomes and benefits that would be realised as a result. We've then taken a detailed look, as Valent mentioned, at 10 of the use cases in particular. We'll talk a little bit more about how these were selected later on, but this aims to give a more detailed insight into the kind of depth and breadth that could be realised through sensitive data linkage. And then for each of these expanded use cases, we've also done some benefit modelling. So building off published models for the different outcomes suggested to demonstrate the potential economic benefit that could be realised through achieving these use cases. And this aims to add to the sort of individual and cohort benefits that you suggested in the workshop to provide a little bit more of a quantitative indication for the value of sensitive data linkage. And if you could nudge me on one more, Valent, just as an example. So at the top, you'll see what might be quite familiar. So those sort of different use case sensitive data equations. We've collated all of those and synthesized them into a database. And in particular, we then sort of grouped the various different bits of data that you wanted to link together under broader domains. So categorizing them into, for example, health domains or economic data or data from the criminal justice system. And this means we can sort of start to have a holistic overview of the sort of popular data sets you want to link together. So if you nudge me on one more, you'll see for each of the 52 use cases, in this example, we've quantified which types of data they're linking and how many different types as well. We've done this not just for the data, but also looking at broader trends across the kind of problems that were addressed and the kind of outcomes that were realised as well. So that's sort of the methodology behind the findings, but I'll hand back to Valent and Mark to talk through those in a little bit more detail.
Thanks, Fiona. So yeah, so I'll cover, I guess, the sort of more sort of aggregated analysis of the 52 use cases, and Mark is going to give us a bit more of a deeper dive into some of those, and crucially how they are sort of structured in the report that will be published. So as Fiona mentioned, before I talk about that, so the way that the report findings have been structured are in these sort of 3 chapters, I suppose, or sections. So as Fiona mentioned, we have 52 different use cases, which I think is a tremendous amount of use cases actually to surface in a single day. So well done. And the way the report is structured is around sort of 3 themes that came out of those use cases collectively. So one is around their diversity. So use cases were cross-disciplinary, so linking data across a diverse number of domains to address their research questions. The second section is on their impact, so where the use cases are really focusing on addressing some of the most pressing challenges facing the UK population. So both kind of more longer standing problems, more persistent challenges in society, as well as sort of more new or emerging challenges like COVID-19 and mental health crises, for example. And finally, the use cases were also notable for innovative approaches in solving these problems. So not just sort of what data you bring together, but how you bring that data together to best offer new insights into tackling these new and persistent societal problems. So I'll take you through each of those different points. So the first is around a diverse range of data sources. So Fiona talked about the 10 different sort of higher level domains. So I think there were over 75 different data types that were surfaced in the use cases. And what PSE were able to do is sort of bin those into different sort of higher level domain categories. And these are the 10. Nothing massively surprising here. I won't take you through them individually, but they include things like social data, health data, consumer data, etc. So so you have 52 use cases for connecting data across domains, over 75 distinct data types, and importantly, I think over 2/3 of those brought data across 3 or more of those sort of high level domains. And this picture here illustrates I guess 2 pieces of information. So the size of the domain, so the number of different data sets that made up those different, sorry, number of use cases in which those domains were represented. And then the thickness of the line is the number of times that that data was linked to some other type of data within the use case. And you can see, I guess, the relative representation of different data types, the demand for different data types for these use cases. And one of the things I think surprised us a little bit initially was how prominent health data was as a type of data. So over 80% of the use cases you wanted to use some type of health data. And that was a tiny bit surprising to us because only just over 1/3, I guess, of participants, so yourselves, identified as working within the Medical Research Council's remit. But when we looked into this in a little bit more detail, it turns out that this was health in its broadest sort of definition. So particularly around social and environmental determinants of health, improving public health, living healthier and happier lives. And often health was sort of a secondary output of the use case. So one example was on understanding long-term unemployment, which is of course a social problem. So understanding long-term unemployment had health data centrally, so it needed lots of health data in order to be able to understand this question. But actually, the problem it was trying to solve was a social problem rather than directly a health problem. And indeed, only one of the 52 use cases addressed a specific clinical intervention. So use cases were diverse. We've seen sort of lots of representation of different kinds of data across different sectors, but they also targeted in terms of their problems, high impact areas, so addressing major UK challenges. So this includes some of the most sort of long-standing or persistent or intractable, should we say, societal problems. So there are a few examples that we've got here. There's social inequality. So inequality has been rising since the late 1970s. Climate change has been something that's been going on since the Industrial Revolution, although it's only been in the last couple of decades that I think collectively we're beginning to understand what a problem this is going to be and the need for collective action for it. There's the productivity paradox, which is also just shown on the bottom left here. So 1/5 of use cases looked at productivity. And this is really the problem of sort of rising productivity since the 1990s, suddenly flatlining since 2008 for reasons that remain mysterious. And finally, obesity. So again, this is a problem that's been, obesity was rising in the UK since the 1970s and really doesn't show any sign of flatlining, not just in the United Kingdom, but globally. So the disease burden from obesity is rising, and it's really proving an intractable problem, not just for the UK, but more widely. So we have these sort of persistent, intractable problems, but there are also use cases on, I guess, more sort of emerging problems, shall we say, or particularly around the impact of changes like access to technology and technology's impact and on things like our mental health and modern lifestyles more generally. And of course, things like the impact of the COVID-19 pandemic and other sort of transformative events like that. So really bringing a new lens to understanding problems that I guess are changing in nature. And families and households was another very common area of focus for many of the use cases, and I'll touch on that in the next section around the innovation that the use cases were demonstrating in terms of their approach and in terms of considering new ways of understanding problems. And I'll come back to that idea of the importance of the family unit. So as was so brilliantly explained in one of the Dragon's Den presentations on this. As individuals, as we're incredibly social animals, and so understanding our health and well-being in the absence of understanding our social context is reasonably limited. So our social environments have crucial roles in terms of our future life opportunities and health and well-being. And so a lot of the use cases were interested in how we can sort of understand that better. So how can we link individuals within, for example, households, which I guess is probably the most obvious social group that we exist in, and that has likely profound influences on our health and well-being. So this is family groups or households, not just sort of biological families, but also social families, who we're living with and how that influences our behavior. And so really using the family unit rather than simply just the individual, and being able to understand, measure and assess and make interventions at that level was really something quite innovative in terms of how we can use sensitive data. Over half of the use cases looked at developing more targeted and resource efficient interventions. So these use cases aren't just about the research that's enabled, but also how we can use that research to make a real difference. 40% looked at identifying high risk groups, mapping contributing factors, and helping to develop preventative approaches, which would be much more beneficial and resource efficient. And around 23%, so just over a fifth, were interested in using sensitive data to understand and develop methods to influence behavioral change. So I think there was particular excitement here around emerging types of sensitive data, so particularly things like wearables and smart data, internet use, etc., in order to be able to influence behavioral change societally. Okay, and now I'll pass over to Mark, who I think will take us give us a bit more of a flavour of some of the individual use cases.
Wonderful. Thanks, Balin. So, as Balin mentioned in the introduction, in addition to sort of the aggregated analysis of all the use cases, we've also curated a list of 10 deep dives or exemplar projects. And these expanded use cases aim to provide the audience. So it is thinking about that informed public with more tangible examples of what enhanced sensitive data infrastructure can be used to do, sort of the complex problems that it can be used to solve, and the benefits that this can deliver towards society. So the purpose of this final section is really to bring to life the real world applications and the impacts of sensitive data connectivity. So just before jumping into the use cases themselves, I'll quickly provide a bit of context on the type of opportunities where DARE can have maximum impact and sort of how this has helped shape our thinking about use case deep dives and sort of what we've prioritised. So as mentioned, throughout the activities, we did surface 52 distinct use cases, all of which were brilliant and all of which connected sensitive data across jurisdictions and at scale to deliver benefit to the public. Whilst DARE is well placed to sort of advance all of these opportunities, in order for the programme to best support sensitive data connectivity to benefit the public, it should focus on opportunities that meet the following 4 criteria. So the first is tractability, so opportunities and research objectives that are achievable with enhanced sensitive data connectivity. So really thinking about barriers that are related to the linkage of sensitive data. The next category is cross-domain, so research objectives that link data across jurisdictions and organisational boundaries. The third criteria is, of course, high benefit, so research objectives that have the potential to significantly improve the lives of the public. And finally, longitudinal. So this is research objectives that use retrospective analysis to measure trends and impact over time. So I'm sure many of you know that conducting longitudinal studies can be sort of very expensive and very difficult to do, but by connecting enough sensitive data at scale, retrospective analysis can sort of replicate many of the elements of traditional longitudinal studies, enabling an understanding of sort of causes, impacts and trends over time. So when we're talking about longitudinal as a criteria, we're really thinking about it through this retrospective lens. And then on to our use cases. So many, if not all, of the use cases surfaces do feature all 4 of these criteria, and to underline the value, we have curated a list of 10. There are of course many more than these 10 that could have been features, as all were fantastic. However, we feel that these 10 are able to demonstrate to the wider audience the flavour of conversations that were taking place in the room and the diversity and the scale of the opportunity we've mentioned. I should state now that this is not to say that these use cases specifically are being taken forward, rather they've been selected to demonstrate the type of opportunities where Dare UK can have maximum impact. So we've chosen 3 today that really do represent this breadth and depth, and they're the ones highlighted in green, but there are a further 7 that we won't speak about today that will be in the final report, which you can read about in April. In the interest of time, I'm not going to read through, but I might just pause here for 15 seconds if you want to quickly read what that list of 10 is before moving on. So hopefully that has given you enough time to quickly skim through. There's just one thing I will say about all of these use cases, so all 10 and actually the 42 others that were collected, is they do all really realise the multifaceted nature of human lives and the wide scope of the challenges and opportunities we face when trying to improve them. They show that sort of no challenge can be viewed in a data domain vacuum, and therefore they demonstrate that in order to effectively understand and then address these multifaceted cross-domain challenges, we need sensitive data and the sensitive data infrastructure that reflects the multi-domain nature of our lives, which is where Dare come in. And if you could just nudge me on, Balint, I'll talk to you a bit more about how we plan on presenting these use cases. So as I've said, the point of this section is to really take the audience on a journey, so that informed public of the point of no understanding and no familiarity with these use cases, to understanding what the use case is, why it's valuable, and really the importance to them and the wider public. So in order to do this, we've created a 2-page summary for each use case, which follows the same structure, and we hope brings to life the real world applications for sensitive data, sort of puts flesh on those theoretical bones. So on the first page, we've got an opening narrative, which provides a brief introduction to the use case and the challenge landscape. And that's designed to sort of indicate to readers that this is both a significant challenge for the UK public and a significant opportunity to improve data linkage. Beneath that, we have a very high level summary of the research questions that we're trying to answer. So a very simplified version of the questions and activities that are involved with this use case. And we sort of put that in the style of, firstly, what can linked sensitive data help us understand? And then secondly, now we have this new linked understanding, what can we do with that understanding? Sort of what can we develop and what benefits can be given as a result? So really these 2 sections are framing the use case and really introducing it, which takes us on to the next slide. Thanks, Balint. And the second page has 3 further sections, which are slightly more detailed and really highlight the importance to the public and go into more detail on the data types used. The first section outlines why it's important to the public, and we've just divided this into impact on individuals and impact upon specific cohorts within society or society as a whole. So this really just showcases some of the key facts and figures that outline, yes, the economic impact, but also the human impact. So we're really focusing on impacts that can be felt and sort of recognised by the public across lives, across society. And then below that, we have a section on the economic benefits that Fiona mentioned earlier. So we took an outcome-based approach. So we looked at the intended outcomes listed by participants for each use case, sort of estimated the potential of these use cases on these desired outcomes, and then provided a quantification of these benefits. I'll just reiterate that these estimates are building upon previous studies and literature in the respective area and serve as sort of an indicative number for the information provided by participants. And then finally, on the right-hand side, this just lists all the data types that were recorded by participants for each use case. And again, we've grouped those by domains. And then I should also say that these aren't exhaustive, and they just reflect what was captured by participants in the room. And then moving us on to the specifics. So the first use case we'd like to show you today is one that's about transforming the food economy. So it's what we eat, how it's produced, what's wasted, and much more. And this has far-reaching consequences across sort of health, productivity, the economy, and the environment. So what is the challenge that we are really trying to get across the public? In short, it's that our long-term health, prosperity, and ability to exist in our natural environment are deeply linked to our food system. So multiple natural and social systems merge to have a profound impact on our lives, but this data is sort of currently siloed, and we're not able to best design and develop our food economy to improve all our lives. So in terms of the research questions, by leveraging sensitive data, we can understand the complex interactions across the entirety of our food economy and the supply chains that feed it. And then in turn, this will enable us to develop policies and take action that simultaneously fulfills our diverse food goals to sort of deliver the long-term health and prosperity that we've talked about. So then moving on to the next slide, how do we get this across to the informed public? So as we've already shown, the food economy has far-reaching impacts beyond our health, and it sort of forms a cornerstone of both individual lives and society. So on an individual level, we're using facts, sort of the fact that obese individuals are 1.2 to 1.6 times more likely to take sick days than their healthy counterparts, which in turn reduces their ability to engage productively in the economy, which of course has, recognized material impacts, but also sometimes less acknowledged impacts such as poorer mental health. And then at a cohort and society level, almost 1 in 5 UK households are estimated to be food insecure, while simultaneously as a nation, we waste, 19 billion pounds worth of food each year. So it's quite clear to demonstrate to the public that our food economy is not optimized and that there are significant opportunities to benefit the public if we can understand and measure the multitude of sort of interactions and outcomes across the multiple domains. And then think about what this could mean for the economy. So based upon our economic modelling, this use case, if it is effectively realised, could deliver over £100 billion of economic benefits to 2050. And these benefits sort of cover a wide range of impacts, from reducing the costs of diet-related ill health, reducing the social, economic and health costs of malnutrition, reducing agriculture's contribution to climate change. The list really does go on. And then finally, what about the data? So how cross-domain is this? This use case linked data across 5 domains, including health, climate and environment, and economic data, with data types including agricultural business data, so for example, subsidies, and food bank use. So this use case really is cross-domain, tractable, high benefit and longitudinal, and that's what we've tried to demonstrate to the public here. It also demonstrates many of the themes that we've already discussed in that aggregated analysis. So using families as a unit of analysis, and also how health and health data is viewed. Yes, health data is used in this use case, but it is sort of linked with many other data sets to look at health in its widest sense. And if we could now move on to the second use case. So taking a slightly different track, looking towards long-term unemployment. So the next use case is understanding and addressing the long-term unemployment. And when we say long-term unemployment, we mean unemployment that lasts over 12 months. So what's the problem that we're trying to convey here? It's that ultimately long-term unemployment creates a vicious cycle. The longer an individual spends outside the workforce, the more difficult it is for them to re-enter as sort of skills fade and experience gaps appear. Obviously, there's the material decrease in earnings and productivity, and that's both at the individual level and societal level. But there's also much further reaching consequences, including detrimental impacts on physical and mental health, and of course, spillover effects for members of their family, household, and social groups. So, as with all the other use cases featured, this use case again recognises the multidimensional nature of our lives, that our health, wealth, and prosperity are all deeply connected, and as such, linking sensitive data across these domains can help address multifaceted problems of long-term employment and hopefully provide far-reaching solutions. But how can sensitive data, actually help to do that? Well, it can help us to understand complex, often lifelong causes of long-term unemployment, and understand the factors that prevent individuals from entering or rejoining the workforce quickly. And in short, what can we do with this renewed understanding that's been enabled by sensitive data linkage? Well, we can develop effective strategies to address root causes of long-term unemployment and crucially prevent individuals from falling out of employment in the first place. So if I just move on to the second slide. So again, how can we convey the importance of this to the wider audience? Well, beyond the economic factors, there are also the human factors, such as the fact that employed individuals are 5 times more likely to report poor health compared to their employed counterparts, or that a quarter of unemployed are under 24 years of age, suggesting that there's some sort of fundamental inability to gain entry into the workforce. And this, of course, has long-term whole life consequences. Naturally, the economics is the key benefit of the use case, so I'll move us on to that. So our modelling indicates that a 5 to 10% reduction in long-term unemployment and a smaller 1 to 2% reduction in economic inactivity amongst those who would like to be employed can provide economic benefits of almost £29 billion to 2050. And as has already been mentioned, connected sensitive data across domains is central to understanding this problem, but what data is actually being linked. So again, it's 3 domains. So it's economic, social care and social system data, and then social data. This includes data such as productivity data, housing data, and income data. And again, as with previous use cases, addressing long-term unemployment touched on many of the aggregated analysis themes. And then I'll move us on to the final use case. So the final use case, I think Balint nodded to it when he was discussing obesity and sort of the family level analysis earlier. So it's using family level analysis and interventions to tackle childhood obesity. So what's the problem? So as we mentioned, obesity is a serious long-standing problem for individuals and society as a whole, with serious long-term health, social and economic consequences. And with nearly a quarter of year 6 pupils currently obese and approximately 60 to 80% carrying this obesity forward into adulthood, addressing childhood obesity could have a huge impact across entire lives. And then again, as has already been mentioned, we understand that how children live and develop is fundamentally shaped by their home environment. So really, in order to effectively tackle this problem, sensitive data needs to be connected, not just at that individual level, but at the level of families and households too. And then into the research questions. So what can it help us to answer? Firstly, we can understand what's causing this childhood obesity. So looking at these complex interactions of health, economic, social, and many more drivers across not just individuals, but each member of the family unit, and how this can influence the health of a child from birth. And equipped with this new understanding, we can discover what works for families to develop integrated, holistic approaches that reflect the diversity of family situations and enable us to create environments that support children's health and reduce obesity. And then on to the final slide. But why is this important? Well, for every obese individual across their lifetime, they will incur an equivalent of £62,000 in quality of life losses. And this is even greater when you consider direct health costs and productivity losses. But it's not just these costs, it's also a question of equality, with children in deprived areas almost twice as likely to be obese than those in more affluent areas. So clearly addressing this problem can have a huge impact on quality of life across society. And then again, just thinking about the economics. So tackling childhood obesity can generate a combined £9 billion of healthcare productivity and quality of life increases to 2050. And sort of as you extend this timeline out further into future, the scale of this benefit increases as less children carry obesity into adulthood, which further reduces the size of the obese adult population. And so as these costs increase over time as you get older, that results in sort of a very big saving as these children move further into their lives. And then just in terms of data, of course, there's health, but in order to understand wider social drivers, data was linked from consumer, lifestyle, social and economic domains. And then, as with all the other use cases, what we try to show is how interconnected each element of our lives is, and therefore how connected data needs to be to truly understand it. Yeah, for this, the primary target is health in terms of childhood obesity, but it's clear that the causes and effects stretch far beyond health. So yeah, what we try to do with these is really tell that story and take people from no understanding to understanding both the use case, the problem, and why it's important, and why we need an innovative new sensitive data infrastructure to help tackle these pressing problems facing our society. So that's it from me. I think I'll hand back to Balint for next steps.
Thanks so much for taking us through that, Mark. So hopefully that's given you a bit of a flavour for some of the use cases that you were able to surface, and how they're going to be presented in the report. So they'll be presented in the report just as Mark took us through. So I'm just going to talk for a couple of minutes now about next steps, and also just sort of to try and give you a bit more of an understanding about how the Dare UK vision is going to support these kinds of research use cases. So at the moment, I suppose, as many of you will probably be aware, realizing these use cases in using the current sort of state of play in sensitive data research infrastructure in the UK would be very difficult, if not currently impossible. So to help illustrate this and what the Dare UK programme helps to achieve, we've got a short sort of animation, and it focuses on a researcher called Rachel, who wants to do a study understanding how geographic location and also people's environments impact COVID-19 in the UK. So much like the use cases that Mark just discussed and all of the use cases that were surfaced during the workshop, she wants to bring together different types of data in order to do this. So she wants to bring together environmental data, which is not sensitive and is readily available for research, together with health data, so that's the one in the middle here, which is sensitive and needs to be accessed within a TRE, and also geographic data, so that can either be sensitive or non-sensitive, depending on whether it's about people. And if it is about people, it needs to be held in a TRE. So this is sort of illustrated in this animation. So in order to be able to do this, so this is Rachel at her TRE. The TRE operator who's providing access to the data needs to talk to multiple different data providers, because all of the data that Rachel needs, those 3 different types of data, is held by different data managers across different data providers and TREs across the country. And as many of you would be aware, this takes a lot of time. And in addition, some of the data that she wants to access, like the environmental data, is actually itself too large to move. So what this essentially means is that Rachel will have to be able to, instead of getting the data sent to her TRE, she needs to be able to actually send her analyses to the data rather than access the data directly. And this is called federated analytics, and it's not at the moment generally supported. So this is where Dare UK comes in. So essentially, with secure, standardized and trusted connections between TREs, moving or analyzing data between TREs becomes much easier. So now Rachel doesn't have to spend months waiting to access the data, and instead Rachel will simply connect to the TRE, and it will make sure that she has access to all of the data that she's allowed to access to carry out her research. And one of the focuses of Dare UK as we move during phase 1, as we move into phase 2, is to develop the technology, science and infrastructure, as well as the standards that are needed to implement this, to enable this more sort of systematic, secure connections across TREs that can support both data sharing and analysis sharing across them. And I think we've made lots of progress in phase 1 in developing some proof of concept, especially for the technology. And in phase 2, we'll be looking to kind of develop these into minimal viable products and demonstrate them using real world exemplars. Okay, so in terms of immediate next steps, so we've got the write-up of the report. So as we've said, we'll incorporate any feedback we get from today into the pre-published report, and we're looking to publish that in about a month's time. So around mid-April we'll probably be publishing that, so we'll let you know when that happens. As I think I mentioned, we want to include all of your names as participants within that report. If you don't want to be included, your name to be included, then please just let us know. So what we're going to use the report for, well, as I said at the beginning, it's going to help us to shape phase 2 of the Dare UK programme, so which will indeed include real-world research exemplars that use Dare UK infrastructure capabilities, so that use some of the technological solutions that have been developed to connect TREs together. And secondly, crucially, we want the report to evidence to the public and indeed to funders of sensitive data research infrastructure the wide-ranging public benefit that investment into infrastructure can bring to when we can sort of connect sensitive data together at scale. And I think that case can be made much more powerfully collectively and as a community than just on sort of ad hoc or as individual researchers. And on that point, we do really want to try and coalesce a community of sensitive data researchers, interdisciplinary researchers and publics around cross-domain sensitive data research. And some of the feedback from participants was how one of the good things about what we were doing was bringing together, I guess, people that you wouldn't have necessarily met in your day-to-day because they're working in different areas, different scientific areas of interest, but are united by a common interest in using sensitive data for research. And I guess there was, in some of the feedback, a plea for supporting more engagement that beyond just that workshop. And so we really want to also hear from you about how we can help you to connect or collaborate with one another. One of the things that it might be worth just highlighting is that we do, as a program, have a community groups initiative. So we've actually been able to channel a bit of funding to support the administration and management of community groups, but also events for around sort of areas that are related to cross-domain sensitive data research and research infrastructure. So if you have ideas for bringing together and coalescing a community or want to form a community group, there's lots more information on our website, and do get in touch with us about it. As I mentioned, there is going to be funding available to support those activities. And we also want to run further workshops or sandpits on the research opportunities and also the challenges that need to be solved in order to be able to realise a sort of a national infrastructure like the one that I showed in the animation. Okay, so we've talked to you for quite a long time, a bit longer than I think a half an hour, but hopefully the next 15 minutes will be enough for us to gather any of your thoughts and feedback. So I don't know, I don't think there's anything in the Q&A. We have a question from Milan. Maybe I'll stop sharing my screen first so we can all see each other. Okay, so Milan's got a question on how much of the use cases will depend on private organizations to be willing to share data. How do we incentivize these organizations? I'll also open up for any of the rest of the their UK delivery team to contribute, or the PSC. I mean, I think we have colleagues from across UKRI as well who are and Smart Data Research UK, for example, who are going to be looking at how we can open up data that's held privately. I think this is definitely a challenge that we have. In terms of incentives, I think there's a powerful incentive here around public benefit, and I think private organizations, when there's not too much of a commercial cost, will be willing to share their data if we can make the case that the research that's enabled by doing it is useful. I think that was demonstrated somewhat during the COVID-19 pandemic. I also understand that sometimes that did involve financial, essentially, public bodies or government buying some of that data to enable access, so that there may also be sort of financial incentives. But I think making the compelling public benefit case, particularly for corporations that want to illustrate that they want to support public benefit, is important. Yeah, I don't know if there's any other reflections from other members of their UK delivery team on that one.
Afternoon, everyone. Yeah, I mean, the only thing I'd say is it's a pretty tough question generally, right? I'm not sure that anyone really has a properly good answer to it. I mean, especially if you look at, for example, the discussions that are ongoing at the moment, even just with the NHS, right? And the whole topic about commercial access to the kinds of data there. I think it's a big challenge. I don't think anyone's really got it cracked. I think we need to remember, though, that certainly for Dare UK, the primary motivation is public benefit. So as much as certainly there can be secondary benefits, which may be monetary or whatever commercial benefits there may be, the primary motivation is always going to be public benefit for the DUK program, and that's where our focus really should be. It is a good question, Milan. So I'm not trying to sort of dodge that question, but it is a hard question to try and crack, especially because there's a lot of diversity in sort of private or industry as well, right? It's the incentives are going to look very different across that piece.
Thanks, Fergus. Yeah, Farzana's got her hand up. Milan, if you want to sort of comment, then do feel free. Do just put your hands up if you want to make comments. Yeah, but Farzana, maybe I'll open it up to you if Milan doesn't have immediate reflections on it. Farzana, I can see your hands up.
Oh, sorry, I was trying to unmute then. Are you saying in terms of obesity is higher compared to affluent areas? But what makes it why people in deprived area more likely to get obesity than compared to someone in an affluent area? And what are the challenges and barriers, and what is any concrete evidence that says that or suggests that? Thank you.
That is just taken from a published study, and I can definitely link that to you. But I think this is almost proving the value of linking all of this sensitive data to better understand all the factors that do influence from obesity to inequality to deprivation. It is this sort of whole holistic view, but I can certainly follow up in an email to provide you with the source for that. It is linked in the footnotes of the report, so you will also be able to see that when the report is published, where all these facts and figures have come from. That's nothing to do with sort of our modelling. That's something taken from a peer-reviewed study.
Yeah, please update me as and when. Thank you.
Thanks, Farzana. And I think it kind of illustrates that in order to develop these use cases, there has been a bit of sort of desk research as well that the PSC team have done to sort of broaden out the evidence around the problem. But wherever that's been done, that'll be referenced, and you'll be able to sort of follow up on where that information is being drawn from. But there has been a bit of a job here to flesh out some of the use cases in terms of their challenges, which I think the PSC have done a really good job doing. But yeah, like I say, hopefully that will all be referenced within the report. Okay, Fiona's got her hand up.
Yeah, I was just going to say there's a question in the chat from Claire around sort of the use cases that were selected for that sort of deep dive analysis, asking what will happen to the others, which I think is a very fair question. As we said, there were 52 and they were all really interesting in their own right. And I guess we've tried to take a selection, so not just the ones from the Dragon's Den exercise, but as you alluded to, others that also received a high number of votes, and also ones that were particularly developed so that we could get that extra detail that Balance alluded to. I do understand that if your use case wasn't taken forward, so you might feel worried that it's not going to be represented. So we do still have all the data from the collective use cases, and we're very much trying to emphasise the breadth that those offered. And as you say, we'll pass that over to DARE so that they won't hopefully get lost. They'll still be that information to hand. I don't know, Balint, if you wanted to add anything on what might happen to those other use cases we're not showcasing in as much detail.
Yeah, I mean, like you say, we'll have all of the data. I think there's probably, quite a lot of interesting analysis that can be done on these. I think it is a lot of information that we've managed to pull together on these. Exactly, how we're going to take that forward beyond the report is a little bit difficult to say, but we'll certainly have access to all of the information that was collected on the day. So yeah, there may be new analyses that we can do. And as Fiona mentioned, we do want to sort of showcase, I guess, across the other use cases that didn't have deep dives, the breadth and diversity of them and their potential impact as well. So even if there's not a deep dive, they will be covered. Fergus, have you got a point on that?
Yeah, I mean, I just wanted to sort of, if I've understood the question from Claire correctly as well, I mean, it's not to say that it's not to say that the Dragon's Den use cases are somehow going to be prioritized without some other process around. So if we go into phase 2, and there are opportunities for, let's say, research exemplars and funding attached to those, it's not to say that somehow this report is going to be sort of prioritize those use cases in a funding call. It will be its own process, an independent process as normal, with an independent panel assessment, all of this. So it's not, I think that's a little bit part of the direction Claire's question is going in. It's not that this sort of exercise is going to then directly prioritize use cases in some sort of funding mechanism, because I think that's what's coming through a little bit there. It will be its own process with an independent panel selection as normal, as per all other funding calls.
Okay, hopefully that's been useful, Claire. Okay, any other questions or comments? All right. Well, if not, yeah, I just wanted to sort of finish by saying thanks again for all of your time. I think, yeah, we had a really interesting day, and hopefully the report will do justice to all of the hard work that you did in putting together some of these use cases. So as I said, we'll be in touch again once the report is published, so you'll be able to look at that. And yeah, really want to sort of stay engaged with you and think about ways in which we can continue to stay engaged with interdisciplinary research, because ultimately the research infrastructure that we as a program are building is going to hopefully be used by you. So we're really keen to think about how we can yeah, coalesce, as I said, a community around cross-domain sensitive data research. So thanks again, and thanks for coming along.